A Dallas healthcare worker diagnosed with the Ebola virus over the weekend was identified Monday as nurse Nina Pham, her family confirmed. Pham, 26, became infected while treating Thomas Eric Duncan, the first Ebola patient to die in the United States. Pham, who graduated from Texas Christian University's nursing program in 2010, is the first person known to contract the disease while in the United States. Thomas Frieden, director of the Centers for Disease Control and Prevention, said Monday that Pham was clinically stable. Frieden also apologized to officials at Texas Health Presbyterian Hospital in Dallas. He said his comments Sunday that Pham's infection was the result of a breach of protocol did not reflect on Pham or the hospital's efforts. "I apologize if people thought I was criticizing the hospital," Frieden said at a press conference Monday. "And I feel awful that a healthcare worker became infected while helping an Ebola patient." Frieden said investigators have yet to determine how Pham was infected. But he stood by the protocols, including the use of masks, gloves and other equipment, saying they have proven safe for healthcare workers for decades. "The existence of the first case of Ebola spread in the U.S. changes some things and it doesn't change some things," he said. "It doesn't change the fact that we know how Ebola spreads. It doesn't change the fact that it's possible to treat Ebola safely. But it does change substantially how we approach it." More than 4,000 people have died in the current Ebola outbreak, the vast majority of them in the West African nations of Liberia, Guinea and Sierra Leone. Frieden urged hospital workers across the USA to watch for patients with fever or other Ebola symptoms who have traveled from those nations. World Health Organization Director General Margaret Chan issued a statement Monday at a conference in Manila calling the outbreak the most severe, acute health emergency seen in modern times. She said development of a vaccine or cure for Ebola has lagged because the virus is prevalent in such poor nations. "The outbreak spotlights the dangers of the world's growing social and economic inequalities," Chan added. "The rich get the best care. The poor are left to die." She said the outbreak is disrupting economies and societies around the world. She said 90% of economic costs of any outbreak come from irrational and disorganized efforts of the public to avoid infection. "Adequately educating the public should allow governments to curb those disruptions," Chan added. "Fear," she said, "spreads faster than any virus." "I have never before seen a health event attract such a high level of international media coverage, day after day after day," Chan said. "I have never seen a health event strike such fear and terror, well beyond the affected countries." The effort to keep infected people out of the U.S. is slowly being ramped up. Screenings of people from the 3 West African nations began Saturday at New York's John F. Kennedy International Airport. 4 more airports are scheduled to begin the enhanced screenings Thursday. In Jacksonville, Florida, Baptist Medical Center said Monday it had isolated a patient who was being tested for Ebola but added that the diagnosis is highly unlikely. The hospital released a statement saying the patient had no fever, a common symptom of Ebola, but did report recent casual contact with a traveler from West Africa. Across the nation, healthcare professionals continued to evaluate how best to treat U.S. Ebola patients should more of them emerge. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, was asked on ABC's Good Morning America if Ebola patients should be sent only to highly specialized containment hospitals. "That is something that should be seriously considered," said Fauci, an immunologist. Rose Andamara, executive director of National Nurses United, a professional association claiming 185,000 members, said the infection of the Dallas nurse only heightens the concerns for medical professionals who are now or in the future could be interacting with Ebola patients. Andamara called for hospitals to implement emergency preparedness plans that would provide training, hazmat suits, isolation rooms and other steps. Nurses at multiple hospitals are alarmed at the inadequate preparation they see at their hospitals, Andamara said in a statement. "The time to act is long overdue."